Chair, may I inquire as the amount of time I have remaining?
Iowa has 4.5 minutes remaining.
Thank you, Mr. Chairman. I yield myself the balance of my time.
The gentleman is recognized.
And first, I'd say in response to the gentleman from Maryland's discussion about the states that have had state courts that have prohibited caps, that's a very reason, one of the reasons that we need this legislation, is that you've had out-of-control liberal judges that have decided that even their state legislatures can't pass the laws, that they want to come in and preempt the states' rights of we, the people of the individual states who elect their general assemblies to make their decisions. And often the judges are set in lifetime appointments where they're not held accountable. So it'd be interesting to look back into each of these states that you've mentioned, the gentleman from Maryland, and address this thing from the perspective of we, the people. Because we, the people, are the power in this country. Our rights come from God, and they're vested in we, the people. And I thought the gentleman from Pennsylvania's look at 1215 was a really deft way to focus on this and speak about the Magna Carta. But there wasn't anybody back in old England in that time that had any shot at filing a liability claim, let alone receiving a frivolous claim that would make one individual vastly wealthy at the expense of a lot of other folks. So this is something that's accumulated over the last 502 years since the Magna Carta was signed. And so I'd say this, health care costs are out of control, due in a large part to unlimited lawsuits and other problems Obamacare failed to solve, or else Obamacare made worse. H.R. 1215 is common sense litigation reform legislation that will rein in overly aggressive health care lawsuits while preserving the ability of plaintiffs to recover unlimited economic damages. The bill applies only to claims concerning the provision of health care goods or services for which coverage is provided in whole or in part by a federal program, a federal subsidy, or a federal tax benefit, giving it a clear federal nexus. This isn't criminal legislation. It doesn't address the cases of rape. We should arrest those people and lock them up in prison and punish them to the max, but it's not the subject of this legislation. And so wherever the federal policy directs or affects the distribution of health care, there's a clear federal reducing the costs of such federal policies. This bill's common sense reforms, which have been the law in California for over 40 years, are the conservatively estimated by the CBO to save at least $50 billion. The previous estimate was $54 billion in federal health care dollars. At the same time, this bill doesn't in any way limit compensation for 100% of plaintiffs' losses. As reported in the Washington Post last month, the U.S. health care spending is projected to accelerate over the next decade. And a study by the Center for Medicare and Medicaid Services projects that the average growth in health care spending will be even faster between 2016 and 2025. The projections are based on an assumption that the legislative status quo will prevail. Studies show that as health care costs rise, wages fall. H.R. 1215 will save billions of dollars in health care costs and will thereby increase wages for workers nationwide. Mr. Chairman, as I look at the picture of how I've watched this, the defensive medicine grow over the years and over the decades, $650 billion potentially, reported by Newsweek article, in unnecessary defensive medicine tests that are done. A doctor that ordered CT scans in massive numbers in a single day, when I see a 97% of the MRIs just to be sure that the diagnosis of an ACL knee injury is protected in the case of liability insurance, we're not going to see just $50 billion in savings here. We're going to see hundreds of billions of dollars in savings. And as an anesthesiologist told me that he was practicing in Texas when Texas passed the law that is roughly a mirror of California law, that his premium as an anesthesiologist was $26,000 a year. And after the law passed in Texas, it dropped to $6,500, exactly 1/4, a 75% reduction in that particular case. He's now practicing in Iowa, where Iowa has passed mirror legislation as well. So I urge all my colleagues to join me in supporting this vital legislation, and I yield back the balance.